Question: how can pancreatic injury be assessed during a physical examination? Answer: during a physical examination, signs of pancreatic injury may include epigastric tenderness, palpable mass, guarding, and Cullen's or Gray-Turner's signs in cases of significant injury with hemorrhage. Question: what imaging studies are commonly used to diagnose pancreatic injury? Answer: imaging studies such as abdominal ultrasound, contrast-enhanced computed tomography, CT, scans, and magnetic resonance imaging, MRI, can help diagnose and evaluate the extent of pancreatic injury. Question: what is the initial management approach for a stable patient with suspected pancreatic injury? Answer: the initial management approach for a stable patient with suspected pancreatic injury involves pain management, fasting, close monitoring of hemodynamic status, and imaging studies to assess the extent of injury.